Hi, I'm Steve Selig, founder of FitTest, and in part 5 and the last part of my series on the European Society of Cardiology guidelines for exercise for patients with cardiovascular and cardiometabolic disease. In part 5, the final part, I'm just going to bring together or present what they have called, the society's called their 10 commandments, which are really the 10 most basic and important guidelines or summary of the guidelines that are useful to bring into the last presentation. And as I have done before, I'm just letting you know that all of the guidelines in the form of full text, pocket guidelines, and even a slide set are all available free online. So just what the society have called the 10 commandments, in other words, the most important elements of their guidelines. All able individuals with cardiovascular disease should engage in at least 150 minutes of exercise per week divided over 5 to even 7 days, or 75 minutes per week of vigorous exercise divided over at least 3 days. Among individuals who are obese and have hypertension or type 2 diabetes, an additional 3 sessions of up to 20 minutes resistance training per week is recommended to further reduce the cardiovascular risk. A pragmatic preliminary approach is required for identifying individuals at high risk of atherosclerotic coronary artery disease, which includes assessment of symptoms, established risk factors, and systemic coronary risk evaluation score. Individuals are deemed at high risk of an adverse cardiac event from atherosclerotic coronary artery disease who aspire to engage in high-intensity exercise, including high-intensity interval training, should have risk stratification that includes an exercise stress test or a functional imaging equivalent. And this really outlines the importance of you people as exercise professionals to at least provide or to conduct a sign, symptom, and fatigue limited incremental exercise test up to at least the levels of intensities that you're going to design or apply your exercise plan. So that is highly recommended. That is what my app FitTest is designed to do. And that's, I believe, is that what you should be doing as a minimum service to your clients when you first make contact with that client. What we're talking about in dot point 4 here is similar to that, but not the same, because an exercise stress test infers that there's at least a medical practitioner involved in that. Now, these are people who have been deemed to be at high risk of an adverse cardiac event during high intensity exercise. So you really need to read point number 4, looking at it from several different levels, from several different perspectives, because it carries a lot of information in it. And please follow that, and that will then help you to provide a safe and effective exercise service. But in terms of how I use my own app FitTest, I will conduct a sign, symptom, and fatigue limited incremental exercise test on a suitable ergometer for every one of my new clients to exercise them up to a level of at least what we're going to program them for exercise. Optimization of medical therapy, assessment of functional capacity, and that then again is what FitTest does, and risk stratification are essential before prescribing exercise in individuals with heart failure. Regular physical activity is the cornerstone for preventing atrial fibrillation in the general population. However, lifelong endurance exercise may increase the risk of atrial fibrillation in some middle-aged and older men. Asymptomatic individuals with morphologically mild hypertrophic cardiomyopathy and a low European Society of Cardiology 5-year risk score may participate in all competitive sport except those where syncope could result in potentially fatal traumatic injury. For example, you're skiing down a steep slope and undergo and experience syncope, that's obviously highly dangerous. Individuals found with severe valvular disease, and in this presentation, in many of my other presentations, I've focused on the left-sided valves of aortic valve and mitral valve, but it applies to, I guess, to somewhat a lesser extent on the right side of the heart. So individuals with severe valvular disease, poor LV function, arrhythmogenic cardiomyopathy, and active myocarditis should not engage in intensive exercise. So we've already in these 10 commandments seen several instances where you've got to be careful with HIIT training. Please apply this judiciously. Individuals receiving anticoagulation and those with an implantable cardioverter defibrillator should avoid collision sports and activities associated with potential trauma to the body. Pretty obvious. Individuals with cardiovascular disease should be informed as to the potential complications and adverse events before engaging in intensive exercise or competitive sport. So this is something that I do as part of my early service with my clients, and I'm sure a lot of you looking at this would do that also. And these are just in pictorial format, showing you these 10 commandments that I've just outlined. And the references, all free. So thank you for looking at this short video and the final in the 5-part series on the 2020 European Society of Cardiology guidelines for exercise for people with cardiovascular disease. You can contact me at any time, info@myfitness.com.au. And thanks for looking, and have a great day.